So the padding that is present in the foot, we lose it. What happens is you can develop corns and calluses, as you can see on the right foot, and it becomes painful to walk in shoes. The most common complaint I get from a patient is the 55-year-old female who can't walk barefoot on their marble floor, and they are extremely having a lot of pain. It feels like you're walking on a pebble. So what we do is you can either use an orthotic, a pad, or a cushion, or now we are taking commonly known fillers used in the face and putting them into the ball of the foot to provide a cushion so that you feel like you're walking more on a pillow, not as much on a pebble. It does last about 6 to 9 months, and it's just an injection right in the office. That will also help walking because you won't feel as much pressure with that 3 times body weight on the ball of the foot. Other conditions in the front of the foot are nerve conditions. You may have heard of neuromas or even neuropathy. Now, neuropathy is a condition that occurs commonly in diabetics, but it can also occur due to alcoholism or other problems associated with low back pain, medication, etc. Diabetes is the #1 problem. You basically cannot feel your feet. It's a nerve condition where you lose the sensation to the foot. So you won't even feel your feet at all. It feels like you're walking on a cloud. It's very important that if you do have this condition that starts with numbness and burning and can go to numbness, complete numbness, that you seek help by a doctor. A neuroma, you're walking, you get a sharp stabbing pain in the front of the foot, you have to stop and rub out your foot or rub your toes. It almost feels like someone takes a knife and stabs your foot. It's usually associated with high heels or tight shoes when you're scrunching the bones together. In between the bones are the nerves. So when you're scrunching the bones together, the nerve gets irritated and can lead to problems of burning. It can also be associated with other nerve problems throughout the body, most commonly the low back. Treatments includes padding, steroid injections, inserts, and better fitting shoes. We talked a little bit about the orthotics, so I won't really go into that in much depth, but that's a dress shoe on the bottom where I showed you the dress insert, and it really helps to control and align your foot better. And on the bottom left, we are showing just some padding and modifications of inserts for neuromas and other conditions. I put in this film because it's extremely important that if you do walk or exercise, that you have good conditioning. Ankle sprains can be very detrimental. They can blow up your foot and can be a surgical correction if you really damage most of the ligaments in and about the ankle. But this is just a slide at the top to show you how big and enlarged an ankle can get. And these are just x-ray pictures showing you can have an increase in space of the ankle just by blowing out the ligaments. Briefly touching on diabetes, it is such a rampant problem and such a difficult problem to control and can have a very detrimental effect on the foot. Neuropathy we discussed in the previous couple of slides, but is a common condition with diabetes, and I can't express the importance enough. If you have neuropathy, you want to seek help. We have a saying that's called the diabetic foot. If you ignore it, it will go away. Lower extremity amputation is extremely common with diabetics, and it's extremely important that if you or somebody you know is diabetic, that they are appropriately controlled and have their feet checked. Certainly other problems are circulatory. Osteoporosis is loss of bone mass, and you get a weakening of your bone structure, as well as poor healing. Tips for diabetics: keep your feet clean and dry. You want to get in the habit of checking your feet every day. You want to look in between your toes and on the bottom of the foot. If you have neuropathy, even if you step on a pedal or a thumbtack or even an insulin needle, you won't feel it in your foot. So you want to look for blisters, bruises, cuts, redness, swelling, anything abnormal. Certainly have a podiatrist cut your toenails. See a doctor immediately if you have a question or you need care due to a sore, never go barefoot, have your circulation checked, and please get inserts or custom shoes if you're diabetic. I wanted to briefly talk about a natural extension that I have gotten into, which is leg vein disease. I had so many patients come to me with swelling and leg vein problems. Here we have some leg vein disease. Poor circulation into the feet associated with swelling, tired, aching, and heavy legs, skin color changes, and pain. Certainly we can all look down and see the spider veins or the bulging varicose veins in the leg, but it's what's under the surface that you don't see that can also be a problem. The newest treatments used to be we would go into the hospital for vein stripping. Now the current modalities are done right in the office, takes 1 hour, and you resume immediate activity the next day. You go back to work. This is called an endovenous laser treatment. We enter the vein with a tiny laser and use the ultrasound to guide our way. Then we numb up the leg along the course of the vein, and we actually use a laser on the vein, which helps to take away the bad flow through the vein. The vein will shrink down, and the blood will just take another path back to the heart. On the bottom of the leg, you can see the bulging varicose veins. If you have the varicose veins, we could do a procedure where we actually just make a small little crochet hook and take it out. So you leave the office, and this is the patient about a month later. It's taken vein care or circulation problems due to vein disease, and we're treating everything right in the office. This is just a little cosmetic slide. I knew there would be mostly women, so I put the spider vein treatment is most commonly performed with sclerotherapy. You may have heard of lasers or topical lasers that are done. We use lasers as well, but still the gold standard of care to get rid of spider veins is sclerotherapy. Sclerotherapy is utilization of a tiny needle where we insert a solution that damages the vessel wall, the body breaks it down, and eliminates the blood. To conclude, I hope I was able to provide everybody today with some tips on your feet, healthy walking, and the importance of taking care of your body as well as your lower extremities. Certainly, if you have any questions, please feel free to ask and contact me. Thank you.
This program was brought to you by the Boca Raton Community Hospital Foundation. Imagine what we can do together.